A hospital is a complex world filled with countless rules and regulations. These guidelines are not just suggestions. They are strict requirements designed to protect everyone who walks through the doors, from patients receiving care to the dedicated staff providing it. A hospital internal audit serves as a crucial self-check to ensure all these rules are being followed correctly. It is a systematic review of the hospital's own operations procedures records. The primary purpose is to identify any potential problems, weaknesses, or non-compliance issues before they are discovered by external regulators, which could lead to significant penalties. This proactive approach helps the hospital maintain high standards of care and operational integrity. So, what exactly is a hospital internal audit in simple terms? Think of it as a detailed health checkup for the hospital itself. That's the core idea. To conduct an effective audit, it is essential to focus on areas that carry the highest risk. One of the most critical areas is medical billing and coding. This process is incredibly complex. Even small errors can lead to significant financial consequences. Auditors meticulously review patient charts and billing claims to ensure they align. They check for the correct application of CPT codes. They check for the correct application of ICD codes. They verify that the medical documentation supports the services billed. Issue: upcoding. Issue: unbundling. Issue: insufficient documentation. Correcting these reduces denials and avoids penalties. Another vital area is OSHA compliance and workplace safety. Hospitals contain many hazards: infectious diseases, chemical exposures, sharp instruments. Audits examine the exposure control plan for bloodborne pathogens. Auditors verify staff safety training. Auditors check proper use of personal protective equipment. Inspect for clear labeling of hazardous materials. Inspect for proper disposal methods. A safe workplace protects the hospital's most valuable asset, its staff, protecting patient information, HIPAA privacy and security. Conducting a successful healthcare internal audit requires a clear and methodical approach. The first step is to identify the high-risk areas that need the most attention. It is not practical to audit everything at once, so prioritization is key. Leaders should start by considering areas with the greatest potential impact on patient safety, on financial stability, on legal compliance. These often include the previously mentioned domains. Once the priorities are set, the second step is to develop a detailed audit plan. This plan acts as the roadmap for the entire review. It should clearly state the audit's objectives and scope, outlining exactly what will be checked and what criteria will be used for evaluation. The plan must also assign specific responsibilities to the audit team members, setting clear timelines and deadlines for each phase of the work. Furthermore, it should list all the documents, records, and data that will be needed. The third step is the field work, where the team evaluates current procedures and practices. This is where the auditors roll up their sleeves and get to work, comparing the hospital's written policies against what is actually happening in daily operations. The goal is to get a complete and accurate picture of the current state of compliance within the audited area. Section 4. The fruits of diligence. Why regular audits are non-negotiable. The benefits of conducting regular internal audits extend far beyond simply avoiding fines. They really do. One of the most significant advantages is the direct improvement of patient care and safety. Audits often uncover inconsistencies in clinical protocols or gaps in staff training that could potentially lead to medical errors. For example, an audit might reveal that a particular unit is not consistently following medication verification procedures. By identifying this issue, the hospital can implement corrective training and reinforce best practices, directly reducing the risk of adverse events and ensuring that every patient receives the safest, highest quality care possible. From a financial perspective, the return on investment for internal audits is substantial. Regulatory fines for non-compliance can be financially crippling, sometimes reaching millions of dollars. HIPAA, billing fraud. An internal audit acts as an early warning system, allowing the hospital to correct issues before they attract the attention of government inspectors. Furthermore, audits of the revenue cycle can uncover billing errors, coding errors that lead to lost revenue from denied claims. By optimizing these processes, the hospital not only avoids penalties, but also improves its financial health. Section 5. Cultivating compliance. Making audits a part of hospital culture. For an internal audit program to be truly effective, it must be supported by a strong culture of compliance that permeates every level of the organization. This means moving away from a perception of audits as a punitive gotcha exercise and reframing them as a collaborative tool for improvement. Leadership must champion this mindset by encouraging open and honest communication. Staff should feel safe to report potential problems or mistakes without fear of blame or retaliation. When employees see themselves as partners in the compliance process, they are more likely to actively participate, share valuable insights, and embrace the changes that result from audit findings. A key component of building this culture is providing regular, relevant, and engaging training. It is not enough to simply have policies written down in a binder. Staff must understand these policies and know how to apply them in their daily work. Training should be ongoing, not just a one-time orientation event. For instance, short monthly refreshers on topics like patient privacy. Proper hand hygiene can be more effective than a long annual lecture. Sharing anonymized findings from recent audits as case studies can also be a powerful educational tool, making the real-world importance of compliance clear to everyone. To make the audit process smoother and more efficient, auditors should use simple, standardized tools. Checklists are invaluable for ensuring that no important item is overlooked during a review. Using standard forms for documenting findings helps maintain consistency and clarity across all audits. When communicating results, auditors should adopt a calm and professional tone, always focusing on solutions rather than problems. Instead of just pointing out a flaw, a good auditor will work with the department to brainstorm practical corrective actions.